the United States, it's just assumed you'll get high blood pressure. My blood pressure isn't high yet, and my physician keeps remarking on that. I keep saying, but I'm in the area. You know, this is what I work at. I live this diet, so I'm hoping mine never goes high. Your blood levels of glucose and insulin. Typically, we think of these from the standpoint of type 2 diabetes, adult onset diabetes, but they have a role in heart disease and cancers that I'll talk about. Phenol content is reported as milligrams per kilogram. If you look at the types of olive oil, basically refined olive oil, and if you look at it in studies, have somewhere less than 20 is fair to say 20 milligrams per kilogram. This study, when they looked at this, that LDL oxidation decreased only for the oil that had 366 milligrams per kilogram. So it was truly the extra virgin olive oil with a moderate high phenol content as opposed to the retail one. So those are the retail olive oil. In this one, this is a high content of phenol, but it compared it to, again, a retail type level, but this showed a decrease in DNA oxidation. So this is where I think that work needs to be done. This is where I think we need to educate our patients that you're using specific extra virgin olive oils and you're using specific levels of phenols. And this is something that's going to come about. I think more and more people are going to, in the market will do this, because I think this is where we'll see much more health benefits. So there's some evidence that the higher phenolic content may lower the LDL more than refined. This is an area that's open, I think, for research. What is definitely is very clear in the literature that the HDL particle, the level will increase with extra virgin olive oil, and it increases higher with the higher phenolic content. And this is the only thing I know that will increase HDL. I remember when I worked in the area in the 80s, people were trying to come up with drugs. They were trying to look at, how do you change the particle? Nothing works. There's no drug that will increase your HDL. Extra virgin olive oil is the only food. And I think this is a really interesting thing to look at. I would love to do a study where you would compare extra virgin olive oil to statins. Statins to me are just awful. We have no pharmaceutical people here, but I just think that they're just terrible, what they do to people, the side effects. And olive oil, I think you'd have the advantage of saying it will lower the LDL as much, but it'll raise the HDL, and it'll do other things that are on the upcoming slides. Then from blood pressure standpoint, compared to sunflower oil, 2 to 3 tablespoons of olive oil. This study tested them after 6 months, so it's not clear how soon it happened. But 2 to 3 tablespoons of extra virgin olive oil led to a significant decrease in both systolic and diastolic blood pressure. Most dietary interventions, you may know, are more likely to change systolic. Diastolic's a little more resistant to change. In this particular study, almost half of the participants actually went off their blood pressure medicines, which is very exciting, I think. I love when food works better than medicines. I'm always very excited when I see those studies. This next study used 4 tablespoons of olive oil a day for just a 4-week period. These were older people. These were older people with blood pressure for a number of years. In a 3-week period, you saw a lowering of systolic blood pressure. This next study looked at women with one of the higher phenolic content, over 500, and they gave them 60 milliliters a day, which is about 4 tablespoons. And in an 8-week period, it lowered both systolic and diastolic. And I put the numbers here because if you're familiar with the literature, different studies looking at changes in blood pressure, 2 or 3 points is big. It's usually significant. These were huge decreases, huge average decreases. I didn't put the standard deviation because that starts to look unwieldy. But these are huge decreases in systolic and diastolic blood pressure. So I think there's something to be said for the higher phenol content being able to lower blood pressure, which I don't know about here, but in the United States, it's just assumed you'll get high blood pressure. My blood pressure isn't high yet, and my physician keeps remarking on that. I keep saying, but I'm in the area. This is what I work at. I live this diet, so I'm hoping mine never goes high.